So, informed consent is a patient's voluntary decision to undergo a procedure or intervention. And when we have informed consent, there are certain things the provider needs to do, and then there are certain things that are the responsibility of the nurse. So, the provider needs to explain the nature of the procedure to the patient, explain the risks and benefits of the procedure to the patient, provide alternative solutions to whatever problem exists, and explain the risks and benefits of those alternatives. The provider needs to make sure the patient fully understands the information and answer any questions that they have. As the nurse, you are not explaining the procedure or the risks and benefits. What you are responsible for doing is signing the consent form as a witness and making sure the patient received all of that information from the provider, and make sure the patient is competent to provide consent and gave their consent voluntarily. So let's talk about what it means to be competent to give consent. In general, you have to be over 18 and not impaired in some way. So patients who are under the influence of drugs and alcohol, patients who are schizophrenic and maybe having hallucinations, and patients with dementia, those patients may not be able to provide informed consent. Also, there are some exceptions to that over 18 rule. So if there are minors who are emancipated, in the military, or married, they actually may be able to provide informed consent. Also, minors who are seeking mental health services may be able to do so without parental consent in most states. So, if as a nurse, when you come to have the patient sign their informed consent form and you're signing as the witness, if the patient decides, I have some more questions about this procedure, it is not your responsibility to answer those questions about the procedure. You need to call the provider up, have them come back, or call the patient to answer those questions. Once the patient has signed that consent form, they have the right to change their mind prior to the procedure if they want to, because that is their right. Like we discussed in the last video, they have the right to refuse treatment at any time, even if they've already signed that consent form.